For my integrative medicine video, I chose the mind-body practice known as yoga, which is an ancient Indian science which is believed to promote general health and has also been shown to have a positive impact in the treatment of several chronic medical conditions. Specifically, this practice is comprised by three different key elements that characterize it, being these body postures, breathing exercises, and meditation, which are all focused mainly on healing the mind. However, this form of alternative therapy has been demonstrated to be beneficial in the treatment of other types of disease, such as several cardiovascular disorders. Hence, to prove that, I consulted three different scientific research papers, the first of them being a study on the therapeutic effects of yoga, conducted by Catherine Woodyard and published in the International Journal of Yoga, which concluded that the practice of yoga generates balanced energy, which is vital for the functioning of the immune system. Especially, yoga leads to an inhibition of the posterior or sympathetic area of the hypothalamus, and this inhibition optimizes the body's sympathetic responses to stressful stimuli and restores autonomic regulatory reflex mechanisms associated with stress. The results of this study showed that there were lower anxiety, heart rate, respiratory rate, blood pressure, and cardiac output levels in patients. Then, the second study I consulted was retrieved from the Journal of Complementary and Integrative Medicine and published by the German scholarly publishing house Walter de Gruyter. In this one, I found that yoga has been proved to help in improving breathing function and coronary artery calcium, increased adaptation to hypoxia, and improved mood. And moreover, it has helped to fostering an overall improvement in cardiovascular health of patients suffering from mood disorders. Finally, the third study I consulted is the one published in the Journal of Thoracic Disease, which studied alternative medicine in atrial fibrillation treatment. Particularly, in this one, I found that in their study there were 52 patients with paroxysmal atrial fibrillation between the ages of 18 and 80 years that were enrolled in the study, from which 49 of them completed the study. After practicing yoga for 60 minutes a day, twice a week for 3 months, there was a decrease in symptomatic non-atrial fibrillation episodes, corresponding to a mean number of symptomatic atrial fibrillation episodes decreased from 3.8 to 2.1, while the symptomatic non-atrial fibrillation episodes decreased from 2.9 to 1.4. In turn, there was also a decrease in heart rate and systolic blood pressure. Yet further, they observed an improvement in quality of life and decrease in anxiety and depression scores. Now, accordingly, yoga has been implemented in conventional medicine as a complementary therapy that has been used to help treat a wide range of health problems. And certainly, this practice does not cure any disease by itself, but it certainly serves as a facilitator in ensuring people who draw upon these conventional medicines to have access to more effective results from primary sources of health due to having a more well-rounded well-being compared to those who do not indulge in this kind of complementary medicine practices. It is only through this kind of complementary practices like yoga that more conventional ones like the prescription and intake of drugs can be somewhat effective whatsoever.